Hello, everyone, and welcome to OPJ Hub. I'm so excited today. So today we have a wonderful discussion on cervical cancer. January is the month of cervical cancer awareness, and you understand that cervical cancer is actually a preventable cancer in women. However, it still affects and claims lives of women in Ghana and beyond. And so today's discussion is centered on creating the awareness and also debunking some of the myths and educating the general public. So I have in the section with me a wonderful doctor. Um, Doctor, she has been one of the very people in my study team. She's amazing. She's intelligent. She's very committed. And ladies and gentlemen, I would like to introduce her. So she is Dr. Vanessa Namwale, a medical doctor with a strong interest in patient care and service. She believes in clear, honest communication and the importance of helping people better understand their health. She's passionate about making meaningful contribution through medicine and community service. Ladies and gentlemen, join me as I warmly welcome our dear speaker who is going to talk about cervical cancer. Thank you so much, Dr. Vanessa. These are your audience. Audience, this is the wonderful doctor who will be speaking on cervical cancer.
Thank you so much, Dr. Joshua, for the wonderful introduction. And I also want to thank the OPJ Hub for this opportunity to come and educate everyone about cervical cancer and why we need to screen and the importance of the disease. Right, so I'll begin by sharing my screen.
Okay.
So today I'll be talking about cervical cancer. And as Dr. Joshua has already said, January is the month of cervical cancer, and it's very important for us to understand this disease and understand why it's so important for us to know about it. Right. So today I would begin by covering a few things. We'll start by looking at the anatomy of the female reproductive part. So we know where exactly the cervix is. We want to know a bit about what cervical cancer is, why it matters for us to know about cervical cancer, the exact cause of cervical cancer, who is at risk, the signs and symptoms one we present with, a screening, what we should expect when we go for screening, how to prevent cervical cancer, and then the impact of the vaccination on the disease as a whole. So I'm beginning by showing us an image. This is the female reproductive system. So this is a female reproductive organ. And with all its labeling, as what concerns us is the cervix. So moving downwards up, we see the vagina over here, and then the next step is the cervix and the cervical canal. So this is an item of importance for us today, talking about cervical cancer. So the cervix is located in the lower part of the uterus, and it connects the vagina, which is right here, to the uterine cavity, which is right here. So this is basically what the cervix is. That is the cervix. And what is cervical cancer? From the name cervical cancer, we know is cancer of the cervix. So this happens when there is a growth of abnormal cells in the cervix. That's the growth of the abnormal cancerous cells in the cervix. That is what leads to cervical cancer. Why do we care? Why is there a whole month dedicated to cervical cancer awareness? Why is everyone trying to prevent this disease? Globally, when we look at a large scale, among women, cervical cancer is the fourth most common cancer in the world, which is quite up there. And when we move into our region, that's our sub-Saharan Africa, cervical cancer is the second most common cancer in women. So we can see that the numbers are high. It's very important for us to learn about it and get to know what this disease is about. We care because cervical cancer is preventable. It's a preventable disease. But however, in Africa, cervical cancer is one of the leading causes of cancer-related deaths among women, which is quite sad. When we look in our country, Ghana, there's an estimate that indicates that if every year, approximately 2,700 women will be diagnosed with cervical cancer. So in Ghana, there's estimate that every year approximately 2,700 women are diagnosed with cervical cancer, and approximately 1,700 of them will die from this disease. I think that's a very huge number out of those who are diagnosed with the disease, which is very sad. So it's very common around the world. In our country too, it has a high death rate. That's why we are putting in so much effort to educate everyone about cervical cancer. So we've learned about the disease. We've learned about what the cervix is. We've seen where it is. We've learned about why we care about cervical cancer. Now I want to know, okay, now I'm interested. What exactly causes this disease? Okay, cervical cancer is caused by a virus. That's the human papilloma virus, also known as HPV. HPV is a sexually transmitted virus. So the transmission is through sexual intercourse. So the skin-to-skin contact, oral sex, and hand-to-genital contact are the various ways in which HPV is transmitted among individuals. There's so many different types of HPV, but when we are dealing with cervical cancer, the specific types are known as the high-risk types. That's the HPV 16 and HPV 18. So what happens is that when a woman is infected with either HPV 16 or HPV 18, if the infection is persistent, meaning the infection is not fought away, it's still, the woman is infected with it for a long period of time, the infection will lead to the formation of precancerous lesions in the cervix. And when this is not noticed early, these precancerous lesions would then progress and lead to the development of cervical cancer in women. So who exactly is at risk of getting cervical cancer? So I want to clarify that being at risk does not mean you would get it. Risk does not equal disease. It just means you are at a higher chance compared to another person to getting cervical cancer. And we've identified the cause, which is HPV 16 and 18. So there are HPV-related risk and the non-HPV-related risk. So under the HPV-related risk, if a woman has had the early onset of sexual activity, meaning they started having sexual activity at a young age, it puts them at a risk of cervical cancer. If a woman has multiple sexual partners, that puts them at a risk of cervical cancer. If a woman was the type to get married, have early marriage, they are also at risk. Having multiple children, and then the first age at which the woman had the first child is also a risk factor for getting cervical cancer. And in women who are immunosuppressed, meaning their immune system is not working as well or is unable to fight diseases as well as the normal person, that's, for example, having a disease like HIV, these people are also put at risk of getting cervical cancer. A woman with a history of sexually transmitted infection, like chlamydia and genital herpes, they are at risk of getting cervical cancer. Someone who also frequently changes sexual partners. So certain jobs like prostitution, or someone who in generally is promiscuous, is also at risk of getting cervical cancer. And a woman who has had a history of another cancer, that's vulvar cancer or vaginal cancer, is also at risk of cervical cancer. When we move on to the non-HPV related causes, low socioeconomic status is one of them. The being of a Black race, you have a higher chance of getting cervical cancer. Using oral contraception, cigarette smoking, and also having a family history. So whether an immediate family member of having cervical cancer, it also increases the risk in which the woman would get cervical cancer. So we've talked about this. Now we've understood where the cervix is, what is cervical cancer, and what is the cause of cervical cancer. So how would I know that, oh, maybe I'm having the signs and symptoms of cervical cancer, I need to go to the hospital? The unfortunate thing is that in the early stages of cervical cancers, there is no symptoms. Women are asymptomatic during that stage. So the woman will be feeling healthy, going about their daily activities. However, they have cervical cancer and it's unknown. So with the asymptomatic patients, they are usually discovered through routine screening. That's why this screening is so important in cervical cancer. As we will move forward, we'll talk about this various types of screening and why it's important. So the asymptomatic patients, they're only discovered through screening. But if the disease progresses to the symptomatic phase, the most common symptoms are these patients will present vaginal bleeding, right? So irregular or abnormally heavy menstrual bleed periods. It used to come within a certain pattern. Now all of a sudden it's not in the same pattern. It's in an irregular pattern. That should give you a clue that, oh, there's something wrong. Possibly it could be cervical cancer. Or another way the abnormal vaginal bleeding can occur is through bleeding after sex. That's postcoital bleeding. If you notice bleeding after sex, that's also a symptom that can point towards cervical cancer. Or bleeding in between periods. You've had your monthly menses, and it's not yet time for the next menses, but you started bleeding, right? That's also a sign of cervical cancer. And bleeding after menopause. As we know, when women hit menopause, they cease menstruation. So if a woman who is at a menopausal age suddenly starts having vaginal bleeding, that should also be a clue to point towards cervical cancer. Another symptom would be vaginal discharge. That's the abnormal vaginal discharge, to be specific. This vaginal discharge is different from the normal vaginal discharge that women have. Normal vaginal discharge is not foul smelling in any way, but this particular vaginal discharge is foul smelling. It has a very distinct foul smell. So that would point you towards cervical cancer. And you see that the consistency, either it will be of a watery consistency, it can also be mucoid or purulent. So abnormal bleeding, abnormal vaginal discharge, especially foul-smelling vaginal discharge, is a key. Those are the two main pointers that would give you the idea that maybe something is wrong. I need to go to the clinic or go visit my doctor to check if I'm having this disease. But when these symptoms advance, the patients can also have symptoms like unexplained weight loss, lower back or pelvic pain, and they may also experience fatigue, just to mention a few. But these are the main symptoms that the patients might have. Let's not forget abnormal vaginal bleeding and abnormal vaginal discharge. So why do we even care? Why do we want to screen? Why is everyone talking about screening during this time? We mentioned earlier, cervical cancer is a preventable disease, right? It's also one of the, in sub-Saharan Africa, we said it's the second most common. In the world, it's the fourth most common cancer that occurs in women. So we know that screening is very important. This disease has a high prevalence. So why do we want to screen in the first place? We said patients are asymptomatic in the early phases. So the goal of the screening is to detect the precancerous cell changes in the cervix before the appearance of symptoms, right? So research has shown that when the cervical cancer has been detected in the early stages, it's usually easier to treat, and it reduces the cancer death rate by 70%. And I think 70%, to save 70% of people who would have died from cervical cancer, I think we would all want to save that group, right? So as I was doing my research, I found this infographic, which was done by the WHO. It was a research it was a survey that was done to see the number of Ghanaian women who has ever been screened for cervical cancer. And unfortunately, 96.4% of Ghanaian women have never been screened for cervical cancer, which is very strange. It's strange and it's also sad, because for our country, cervical cancer is up there in the number of cancer-related deaths, and 96% of our women haven't even screened for it. It's very unfortunate. So we are all here to encourage all of us to screen, to learn about the disease and see why it's important for us to screen. So screening, what is this screening I'm talking about? How or what are the types of screening methods that will be used when you go to the hospital or wherever you get your screening done? So there are 3 types of screening methods that are done for cervical cancer. So that's the HPV test, as we see over here. And the second one would be the pap test, which is also commonly known as pap smear, but it can also be known as cytology, so cervical cytology. And then the third one is the co-test. So that's the HPV pap co-test, which is the combination of both. So the HPV test is used to test for infections with the high-risk HPV. So checking for HPV 16 and the infection of HPV 16 and 18. While the pap test, that one is used to check if there is a presence of either the precancerous cells or the cancerous cells in the cervix. That's what the pap test does. And with the HPV pap test, it does the combination of both. So who is eligible to get screened? It's recommended that women between the ages of 21 to 65 should get screened for cervical cancer. For women less than 21, screening is not recommended. Why? Cervical cancer is it's rare under the age of 21, so screening isn't recommended. And for women between the ages of 21 to 65, the screening test, we talked about HPV test, pap test, co-test. We would recommend that screening is done every 5 years or every 3 years, depending on which of the screening methods that you use. So if you use the HPV test or you do the co-test, right? If you either do the HPV testing or the co-test, you want to screen every 5 years. If your screening method is the pap test, that's pap smear, the screening should be done every 3 years. So screening, once again, ages between 21 to 65. And depending on the screening method, it's either you screen every 5 years or screen every 3 years. But for women who are over the age of 65, most of them will stop screening, especially for those who have consistently have negative results during the times that they screened in the previous 10 years. There's no need for them to screen anymore, right? If it was negative, then the chances of them getting cervical cancer at that age is very low. So where exactly will I get screened? Or where exactly would you get screened? You've understood the importance of this disease. You've understood that it has a high mortality death rate, and you've understood the importance of screening. So where would I go? You can visit your local hospital, in your clinics, your community clinics, your community health centers. So any place that offers HPV and pap tests, you can go there. Usually any place, I would say any place that has a family planning unit or an obstetric and gynecological unit. That's where most people go to the OBGYN to get these tests done. But if you go to a place with a family planning unit, sometimes in the community centers, I've been in a community center, it's family planning units. They offer the pap smear and the HPV tests as well. So any place that offers these services, you can go there to get screened. And we just want to clarify that screening is painless, right? It's a very painless process and it's very efficient. The best way to detect these precancerous cells before they develop into cancer. So you've now decided to get screened. So you've made your way to your healthcare facility, your OBGYN, your community health center, wherever. What do you expect? I want to just shed a little bit of light of what to expect when you get there. So when you get there, you would be asked to lay on your back because the test is a type of pelvic exam, right? So you'd be on your back with your knees bent and your feet supported, kind of similar to what is happening to this lady over here. Once you are in that position, the healthcare provider will insert a device known as a speculum, which is right here. That's the speculum. It's not painful at all. You might feel some mild discomfort, but there's no pain involved, right? So with this device, it will enable this healthcare provider to see and visualize your cervix. So this is what the cervix looks like when you are looking at it directly ahead, right? So next, the healthcare provider will take either a brush or a spatula. And we see in this picture, there's a brush right there. Also, a spatula can be used to brush and to collect cells from the cervix. So we see this with the healthcare provider doing this on the cervix, taking the cells for the sample. So once this is taken out, the sample will be taken to the lab for whatever test you are doing, whether HPV, pap test, or co-test, right? That's what we've done. And this will be done in a few minutes. It doesn't take too long, doesn't cause any pain. It's just slightly uncomfortable, but a few minutes of discomfort for your life, I think is very worth it. So this is what to expect when you come to a healthcare facility to do cervical cancer screening. But the best way to prevent cervical cancer is through vaccination, as the HPV vaccine, right? The HPV vaccine, it prevents the infection of HPV, not just 16 and 18, but other HPV-related infections. So it's highly effective at preventing infections, cervical cancer, and other HPV-related cancers. And the recommended age group for this vaccine is for girls and boys between the ages of 9 to 14 years. And the wonderful thing is that last year, that's 2025, Ghana launched this nationwide vaccination for girls between the ages of 19 to 14, providing this life-saving intervention for cervical cancer. So what is exactly the effects this vaccine has? Like, the best way to prevent HPV is to get the vaccine. So how does this vaccine help? So here, there's a graph that shows the effects of the vaccine over the years, showing the number of people who got cervical cancer as the years go by. So on the x-axis, we see the age at follow-up in years, and on the y-axis, so they had a group of 100,000 people. In this 100,000, in this group of 100,000 people, there were three groups. That's the unvaccinated group, the vaccinated at 17 to 30 years of age, and vaccinated at less than 17 years of age. So before I continue, I just want to clarify that the recommended age for vaccination is between 9 to 14 years, but the cutoff age, if you were unable to get vaccinated within that age, the cutoff age to get vaccinated is 25 years, right? That's what is recommended. So we see that per this 100,000 people, the unvaccinated, that's in the orange line, which we see over here. As the years go by, the rate of cervical cancer among those group of people increases as the years go by. We see it keeps going up and up. But with the group of people who were vaccinated at age 17 to 30 years of age, see that they also we see that the incidence or the rate of cervical cancer is also going up, but it's not as high as the unvaccinated groups, right? It's going up, but it's not as high. However, those who are vaccinated less than 17 years of age, that's within the recommended vaccination age. So we notice that is significantly low. The number of people who get cervical cancer after being vaccinated is significantly low. So it shows how effective this vaccine is. So we really encourage women and children, all children, boys and girls, between the ages of 9 to 14 years to get vaccinated with the HPV vaccine. So this brings me towards the end of my presentation. Just a few things we should take home. We've now established that we know and we are very certain that cervical cancer is a preventable disease. And HPV causes most of these cases of cervical cancer. And we understand that it's very important for us to screen because screening saves lives and vaccination protects our future. So I want to thank you so much for joining me in this presentation. And if there's any questions or any clarifications that will be needed, please feel free to let me know. Thank you.
All right. Thank you so much, Dr. Vanessa. Thank you so much, Dr. Vanessa. We really appreciate your time. I mean, this is a wonderful presentation, and we learned a lot. There's a bit of myth here. I want you to debunk it in the space of, let's say, 3 minutes. Let's use 3 minutes to do the debunking. So
Okay.
there's out there that men has nothing to do with cervical cancer. Please, can you help us understand with that regard that cervical cancer is only in women, and so men has no role to play in cervical cancer?
Okay. So men have a role to play in cervical cancer. I think I mentioned that the vaccination, we vaccinate both boys and girls. And HPV, which we said is the cause of cervical cancer, is a sexually transmitted infection. So meaning that it can affect both males and females. The thing with men is that men do not have cervixes. They don't have cervix, so they cannot get cervical cancer. So the unfortunate part is that women are the ones who are facing the consequence of that infection. But men can also transfer HPV via sexual partners.
Okay.
That's why it's important for boys to get vaccinated as well.
Okay. All right. And then again, with the HPV vaccine, recently when they were doing a nationwide distribution of the vaccine, I heard some myth that, our young girls, once they receive this vaccine in long and in the future, they are going to be barren. And so I wanted to clear that air for us. Yes, please.
Well,
Would that
that's that. No, it's not true at all. This vaccine is supposed to help us. It's supposed to help our young ladies as they grow up, not to face this horrible disease of cervical cancer. It's rather protecting their futures. So it's not barrenness in any way.
Thank you so much. There's something
Mhm.
about multiple sexual partners is one of the risk factor to cervical cancer. So there's a myth out there that once you have only a single sexual partner, your chances of getting cervical cancer, you'll not get cervical cancer anyway. So I want you to maybe tell us, is it true that even if the person has only one sexual partner and the partner has HPV, I mean the virus transferred to her, she will not get the cervical cancer? Yeah.
No partner, and your sexual partner has the HPV infection and transfers it to you, it increases your risk of getting cervical cancer. It doesn't matter if it's 1, 2, 3, 5. As long as you come in contact with someone who has the HPV infection and you get infected as well, then your chances of getting cervical cancer would increase.
All right. Thank you so much, Dr. Vanessa Namwani. We really appreciate your time today. And guys, I hope you were all blessed. Don't forget to your loved ones and friends, like this video, and then subscribe to this channel as well. And until then, see you in the next episode. Then, bye for now. Thank
Thank
you,
you.
Doc.
Thank you.